Hi, so my name is Alexander Martin, and I'm going to be explaining esophageal cancer today. So, esophageal cancer is a cancer that occurs in the esophagus, and the esophagus is the long hollow tube that runs from your throat to your stomach. So it's right here and goes all the way down to your stomach. And your esophagus is pretty much what helps you move food and liquids from your throat down to your stomach. Esophageal cancer usually begins in the cells that are inside the esophagus, and esophageal cancer can occur pretty much anywhere along the esophagus. It could either start way up here, it could begin down towards your stomach more, it could just be anywhere in that esophagus. And it's actually it's more common for men to get esophageal cancer than women. And esophageal cancer is the sixth most common death from cancer worldwide, and rates of this cancer really vary on location. It could be higher somewhere and lower somewhere else, so it really just completely depends on location. And when it comes to signs and symptoms of esophageal cancer, you have difficulty swallowing, coughing or hoarseness, worsening indigestion and heartburn, chest pain, pressure and burning, and weight loss when you're not trying to lose weight. So it's just happening without you really doing anything to lose weight. And actually, early signs of esophageal cancer don't really exist. There really aren't any symptoms, and it's usually when people have advanced forms is when they start developing symptoms and come in to the doctor and go from there. So no one's really sure what the cause of esophageal cancer is. It's when the cells in your esophagus develop errors, which are mutations, and it's in their DNA. And the errors make cells, and that's when they divide out of control, and that's how it spreads over time. And the accumulating cells, what they'll do is they'll form a tumor, and that will be in the esophagus, and then that can grow to invade more structures or spread to other parts of your body from there. And there's actually a few types of esophageal cancer. You have the adenocarcinoma, which begins in the cells of the mucus secreting glands of the esophagus, and adenocarcinoma occurs most often in the lower portion of the esophagus, so more down here towards your stomach too. And it's actually the most common form of esophageal cancer in the United States, and it's actually most common in white men. And then you have squamous cell carcinoma, which the squamous cells are flat, thin cells that line the surface of the esophagus. The squamous cells occur most often in the upper and middle portions of the esophagus, and the squamous cell carcinoma is the most prevalent esophageal cancer worldwide. So this is the most common throughout the entire world. And there's other rare types. You have excuse me, small cell carcinoma, sarcoma, lymphoma, melanoma, and a few other ones, etc., etc. And there's actually a lot of risk factors when it comes to esophageal cancer. And things that really add to the chances of you getting it is having GERD, which is gastroesophageal reflux disease, smoking, being obese, having bowel reflux, having extensive and progressive acid reflux, not eating enough fruits and vegetables, having a steady habit of drinking hot liquids, and drinking excessive alcohol can all increase your chances of getting this cancer. And there's also a lot of complications, as the esophageal cancer advances in your body. So, let's see, you can get obstruction of the esophagus, where the esophagus will tighten up and there will be less room in there. So it makes it much more difficult, or pretty much almost impossible, for you to swallow food or swallow any liquids. And for example, here you have the esophagus right here, which is in white, and you can tell how it curves a little bit, it's not on that normal straight path. The cancer is causing it to be squeezed over to the side, which makes it really hard to swallow liquids or food. And okay, to prevent this cancer, you can quit smoking, drink alcohol in moderation if doing it at all. You know, you don't have to drink, period, and any of that's good for your chances. Eating more fruit and vegetables, that's always great, and maintaining a healthy weight. So really just being the healthiest you can be is the best way to prevent getting this cancer. And for diagnosis and treatments, what the doctor will do, they'll use a scope to examine your esophagus, which is an endoscopy. During the endoscopy, your doctor passes a flexible tube which has a video camera on it, and it goes down your throat into your esophagus. And using the endoscope, the doctor examines the esophagus looking for the cancer or just areas of inflammation. And for example, here is a picture of an endoscopy. So here's the cancer in the esophagus. This is the esophagus right here, the tube going down. And this is just a certain tumor that is developed in the esophagus. And you can also, what the doctor can also do, they'll collect a sample of tissue for testing, which is, it's called a biopsy. And the doctor will use a special scope that passes down your throat. They'll take a small sample of the suspicious tissue, then they'll send it to a lab and look for cancer cells from there. When it comes to treatment, there's a lot of different types of treatment. You can do surgery, surgery just to remove the small tumors before the cancer has progressed enough. You can do surgery to remove a small portion of the esophagus, and you can also do surgery to remove the esophagus and parts of the stomach as well if it's progressed deeper and deeper. And there's also treatments for complications. When you can't eat and drink, that's a huge complication. Like, you have to do that to survive. So they'll relieve the esophageal obstruction, and that's when the esophagus has been narrowed, and the surgeon may use an endoscope or special tools that will place a metal tube to hold the esophagus open to keep it not so tight so you can eat and drink. And what they can also do is give you a feeding tube directly into your stomach right in here, and they will provide nutrition from there. And I actually witnessed this firsthand. My grandmother, she developed esophageal cancer, and it was a terrible form of cancer, and unfortunately she passed away. The cancer rate, or the survival rate, is actually only 15 to 20%, so it's very low. She had to get a feeding tube. She went through all the different types of treatments and all the complications. She couldn't eat, she couldn't drink. But the worst thing really was, it was very painful, and she had to have a feeding tube because she couldn't eat or drink. And the acid reflux was also just ridiculous. She really just could not go on. The complications just got worse and worse, and they tried all the treatments, but nothing could fight the cancer, unfortunately. That's what really drove me to talk about this today. But back on to the ways to treat it. Chemotherapy is another thing they can do, and that's when they use chemicals to kill the cancer cells. So chemotherapy are drugs that are typically used before and after the surgery with esophageal cancer. And it can also be used with radiation therapy, which radiation therapy is when they use high-powered X-ray beams to kill the cancer cells directly. So radiation typically will come from a machine outside your body that will aim beams at the cancer and kill them that way, but radiation in very rare cases can be put in the body as well and treated that way. So this cancer, it's a terrible cancer. It's extremely dangerous, and it's a horrible form of cancer, and it's almost just, sometimes it's almost impossible to treat. If the cancer has progressed into a later form, it's much more difficult and nearly impossible. And for example, here's the cancer in an early stage. It's just a small tumor, and from here, this is it progressing slowly and slowly, and as it progresses, it goes into more parts of the body, and it will spread through your lymph nodes here, and really just progress and get worse and worse. And so the earliest stages, it's treatable, but it's still it's very likely that you can't beat the cancer. But you'll have a better chance when it's early. Once it's progressed later, it's almost impossible, and really all you can do is prolong someone's life as much as you can. Here's another example. This is just a diagram to show this is your esophagus, and it goes all the way down to your stomach, so it goes a little further. But there's a small tumor. This would technically be an early stage, since it's all in one position and it hasn't spread anywhere else. But yeah, so the cancer, it's just a terrible form of cancer. I hate that it hits so close to home with my grandma passing away, but hopefully eventually doctors will be able to find new ways to treat it and maybe treat it earlier. So yeah, that's esophageal cancer, and I hope you enjoyed it. Thank you.